So how often is it that a person needs to shampoo their hair? And is it different for men and women?
Yes.
Maybe like 80 to 90% of the women that you meet these days, I'm sure they have either highlighted their hair or something.
Absolutely.
Is that good in the long run?
It requires a lot of multiple steps to actually bleach out all that hair, and that, of course, bleach can be quite harsh on the hair and it can actually affect the texture. And occasionally, if the bleach comes in contact with the scalp, it can cause bleach burns and sudden and hair fall in those areas.
I've seen infants who've now started developing graying or white hair.
Right.
Is that a condition or a one-off?
If you have a family history of early graying, then you're more likely to gray earlier.
Is graying reversible? Does it really happen?
So graying is reversible, especially.
Hi, and welcome to another episode of Expert Talk with Bhavya Desai. In this episode, we have Dr. Rickson Pereira, who's come back on the podcast. For anyone who's not seen the previous podcast, then in that podcast, we spoke about skin and we also touched upon hair a little bit as well. So we're going to put that one here in terms of the cards if you want to see that. But hair is such an important part of your body, because it can really change the way you look. For example, a good hair day can really make your day, make you feel really confident about yourself and also about how you're looking to the world. And similarly, a bad hair day can have a same effect, which is absolutely reverse than what you feel. So that's why in this episode, we've discussed so much about hair, and also hair in terms of a very basic general level. You know, everyday situations, everyday scenarios about what it really does when it comes to maintaining your hair, really using products or not to use products, remedies, whether they really work or not. So this one's really interesting because I feel it's a very informative episode, because after watching this episode, there are so many myths that you might basically have thought of. They will not be there, and also in terms of a general regimen of how to actually have a healthy mane is also going to be answered. So if you like our work, then please make sure that you like, share and subscribe to our channel, because it's a small step for you, but it motivates us to do a lot more. Also, if you're someone who really likes audio podcasts as well, then now our podcasts are available on all audio streaming platforms like Amazon, like Spotify, like Apple podcasts as well. So do check them out. And also do follow us on all of these platforms as well. And see you in the next one. So hi, Dr. Rickson. Welcome back to the podcast. Of course, I think last time when you were here, we discussed so much about skin and a little bit about hair as well. But then we were not able to touch upon so many things which were still in my head. There were so many questions that were still coming. So that's the reason why it was imminent that obviously we have you back, especially to discuss something about hair, because I feel that's such an important aspect of how you look today and how you present yourself. So before doing that, how's the experience of the podcast?
I think it's wonderful. I'm glad to be here. Thanks for having me. And hair is a very important aspect of any human being's life, because it is the crown that one never takes off.
Right.
And it is tied down to self-confidence. A good hair day can enhance your self-confidence. A bad hair day will do the opposite. You know, and it's just not just a physical attribute. It's how a person expresses themselves.
Yes.
It alludes to their profession, your personal beliefs, religious beliefs. All of these are tied down to hair. So it's a very important form of self-expression. And we find that it causes a lot of distress, when this physical attribute gets affected. So yeah.
Interesting. Okay, so let's start with the very simple basic one first. Now, weather, right? It's changing. Of course, we are a tropical country, really hot, humid sort of a climate. Now the weather has also changed from being somewhere like a little wintry to like hot, now to rains. How does that affect one's hair?
So changes of weather can affect the hair and the scalp both. In more hot and humid weathers, the scalp tends to, especially in a lot of young individuals, it tends to become a little more oily.
Okay.
if you don't shampoo frequently or regularly, there can be a lot of buildup, and that can affect the health of the hair over a long period. Also, the during humid weather, the hair texture may change. It becomes more frizzy in a lot of people who have wavy hair, with curls. It tends to absorb more moisture from the air because the way the cuticle structure is, and it tends to frizz out a lot. And when it comes to hot weather, hot and dry weather, of course, that can affect the texture of the hair, especially if you're outdoors in the sun. The UV light can do a lot of sun damage because we have dark hair, and dark hair absorbs light. So it can cause a lot of damage to the hair. It can there are certain bonds in the hair which it can disrupt, and that can affect the quality, and it may take a long time for it to repair. So especially hot and dry weather, that's an issue. Then in cold and dry weather, the scalp can become a little dry, and that can sometimes cause itchiness. Although the good thing about cold weather is at least the frizziness goes down, but the scalp tends to dry out and become itchy. So we have a lot of patients who are dealing with dandruff and a condition called a seborrheic dermatitis psoriasis. These typically tend to flare up in cold weather as well as in hot and humid weather. So extremes of weather can affect the scalp and hair negatively.
Understand.
Yeah, the best kind of weather would be like cool, humid weather, or cool,
pleasant,
slightly,
like the European types, which
absolutely
most of the people prefer going during the vacation time. Now, you mentioned that we have dark hair, and dark hair tends to absorb light. So, is there a difference between like the hair that Indians have as compared to what people have globally?
I would say, Indians, we are a mixed race. There are multiple racial ethnic groups that have actually, merged and, produced the Indian phenotype. So typically we see that our hair, the South Asian hair is typically, it's thicker, and it's slightly wavy, and because generally scalps with thicker hair, they have or curlier hair, they tend to have a lower density as compared to a person who has fine hair and straight hair. So there may be a slight, the follicular density may be low, but thickness of the hair, the average thickness is much higher.
Understand.
So,
but from that perspective, is it like that? Like usually, because when you see as well, visually, when you're traveling abroad as well, so you see like Caucasian hair is very different, blonde hair is very different, the texture, the style.
Yes.
In terms of what you can do with the hair, also, it's a lot different.
Yes.
So does that also play a very important role of how you can style it and what you can do with the hair?
Absolutely. Indian hair generally tends to be more thicker. So at least in a person who's not having a hair thinning issue, the hair is quite resilient. And of course, as one gets older, or if they have a medical condition which causes the hair texture to change, then those hair are less resistant to weathering. But I would say Indian hair is quite thick and resilient in those terms. It's thicker than Western or Caucasian hair.
Right.
So it's a little more resilient.
Does that also play a very important role in terms of the styling that you can do around it? The reason I ask is because, everybody pretty much has seen, taking an example, if you say for men, somebody like Tom Cruise, you take the Mission Impossible 1 and 2, where he really has long hair and just beautifully free flowing, and the haircut and stuff like that. I'm sure anybody who resonates or understands that era with the Mission Impossibles, then I'm sure there must be countless people who must have gone to their stylist or the salon, saying that, what, I have long hair, I would love to get a haircut like that. But then that depends on the quality as well.
Right. So across India there are different the hair morphology, the type of hair also changes, right? Some people have straight long hair or slightly wavy hair, and then some people have more curly hair. So in fact, with curly hair, they're in fact more liable to get damaged with styling. So you have to be a little more careful when you're dealing with curls or wavy hair, because they're more likely to get tangled and broken during styling. Whereas hair that is a little more straighter and smoother, it tends to be a little more resistant to wear and tear. So I think styling would depend on the quality of hair that you have, your facial structure, all of that will matter. But generally the rule is if your hair is more curly, you have to be a little more gentle with your hair,
Right.
as opposed to hair that is more straighter. It tends to, but that's the issue. And curly hair tends to frizz out also in in high humidity,
Right.
atmospheric humidity.
So we spoke about styling, right? So in that case, I think it's a very important question that a lot of women also usually always ask, and they have a challenge in this case, wherein how do you take care of like or minimize split ends? Things like this, especially when you're actually getting a lot of haircuts, and how do you do that? Because that's something which is
Right.
I'm assuming that's a problem with a lot of
Right.
women and their hair.
So split ends are basically tied down to the structure of the hair. If they already have a weak like sort of shaft to begin with, they're more likely to get split ends. If once their hair grows really long, because the hair grows at the rate of 1.25 centimeters a month. So for a woman who has waist length, that hair has been growing on for a while, 6 to 7 years. So it carries all that weathering with it. Also, the initial structure, the basic hair structure, the quality of the hair as it grows out of the scalp, depending on its protein composition, the thickness, all of these will determine whether your hair is likely to develop split ends or not. And then, of course, during those years that it is growing, uh, depends on the amount of styling that you do, the amount of sun damage, the kind of weather it is exposed to. All of these factors will determine, the development of split ends. So typically, we see that more in women who have longer hair. So the way to treat it is to actually cut off those split ends so that the hair doesn't split along the length, because a split end you can extend along the length of the hair. So it's important that you trim away the split ends and use good conditioners after your shampoo. Actually, it's a myth. There's a big myth when it comes to conditioners, that conditioners actually trigger hair fall.
Okay.
And that is not true. And that's why a lot of people avoid using conditioners. But conditioners are very important especially if you have long hair, in maintaining the hair quality, because every time you wash the hair, it affects the structure of the hair. It changes the pH. And what a conditioner does is it neutralizes the residues of the shampoo, it resets the pH, and generally, reinforces the cuticle of the hair.
Right.
So it makes the hair a lot more softer and more resilient to weathering, and it will protect the hair from developing split ends.
Understand.
So that is, I think that basic care needs to be taken when you're dealing with any kind of hair. And as you get older, the hair becomes more fragile. That's an age-related change. So it becomes even more important to start conditioning as your hair as you get older.
Right.
Generally, younger individuals have more thicker hair and they are much more stronger. But as we get older, you need to take care of need to take a little additional care in order to maintain the quality of hair.
Right. Interesting that you speak about this conditioning and shampoo. So how often is it that a person needs to shampoo their hair, and is it different for men and women?
Yes. So for men tend to have more oily scalps. So daily shampooing is actually good. Because we have more oily scalp, there is more buildup of dead skin cells. There are natural bacteria and yeast that grow on those dead skin cells. So and typically, if you don't shampoo every day, the residues sort of build up. I would say at least wash every day. For a person who has dry scalp, maybe you can shampoo every alternate day. But for men, I think the good thing, basic amount of, in 24 hours at least, you should wash your hair once, or at least every alternate day, maybe in very cold weather.
Right.
For women, their scalps tend to be less oily, and for them, once they wash their hair, especially if they have long hair, it's cumbersome for them to dry it out. So for women, every alternate day is a good this, especially in warm, humid weather. So every alternate day is a good frequency. But in drier weather, or if you have dry scalps or someone who's aging, you can maybe shampoo twice in a week.
Right.
But I think that, so it varies based on age, the ambient weather and climate, and the scalp, dryness. Or if they're using products, if you're using any styling products, I would recommend that you shampoo it once, at least at the end of the day, to get rid of any residues.
Yes. So I want to come to the styling products bit. I've got lots of questions about that as well. But so that means it's a myth, ideally, that usually people believe that you are not supposed to shampoo your hair every day, and it can actually, because in some cases people do also believe that when you shampoo it a lot, you tend to lose hair. Is that true?
So, your hair growth is influenced by scalp health also. It plays an important role. And you have to, for people who generally tend to have more oily scalps, more flaky scalps, it's a good idea for them to shampoo, so that buildup causes bacterial and fungal growth. And that actually triggers your immune system, and your immune system secretes certain proteins to, attack the bacteria and yeast. And that's why it triggers scalp inflammation.
Okay.
So that's why it's important to sort of clean up the scalp. So in fact, we've seen that people who shampoo less frequently, they actually tend to develop more hair loss. One thing is, when we shampoo, some of the dead hairs are released. So that's what you see, a normal hair fall that happens. But for example, if you don't shampoo for 4 days, whatever hair was supposed to be lost over a period of, with every shampoo, they sort of accumulate over 4 days. And then you will see that when they wash after 4 days, they'll see a lot of hair falling. So that's why it's important that you shampoo regularly and frequently, because it actually improves the scalp health. And eventually, anyone who has issues with excessive hair fall, it actually plays a role in reducing that hair fall.
But shampooing, do really expensive shampoos work? Because, of course, you mentioned about shampooing. And then from a consumer standpoint, there are different levels of shampoos, right? There are shampoos which are as low as, I would say, the affordable range. Then there are like these L'Oreal's and XYZ, which are a little bit expensive. And then there's the ultra premium range, wherein you go to a lot of these salons, you probably go to a dermatologist as well. They always suggest some certain shampoos. Is there a difference between those in terms of the products?
Right. So generally, shampoos that are more affordable, they tend to have sulfated detergents, what we call. And then there is a class of shampoos called as sulfate-free detergents.
Okay.
So typically, sulfated detergents are an old generation of cleansers, which are, in fact, they're stronger. They cleanse more effectively. So they're actually good for oily scalps. And because they're older generation, they are generally more affordable. So if you see that you'll always have sulfated detergents and shampoos that are more affordable.
Right.
Whereas premium ranges, L'Oreal, Kerastase, any of Tony and Guy, Sebastian, so there's so many. So all of these have either a mix of sulfated and non-sulfated detergents, or they have sulfate-free shampoos. Because if your hair is typically over-processed, or you've done any smoothing procedure like a keratin or a cysteine, you want that to last a little longer, and that's why they prefer sulfate-free shampoos, because sulfated shampoos tend to be a little stronger, so they tend to wash off the styling polymers that are put onto the hair. It tends to wash it off. But sulfated detergents are really good when you're dealing with a very oily scalp, or when you're trying to clear up residues of styling products. So it really depends on what your scalp is like, and what your hair quality is, whether it's been processed, not processed, if it's young hair, old hair. So typically, hair that are more younger, resilient, you can use sulfated shampoos. Whereas hair that has been over processed, it's been colored, smoothened, styled, or they're prone to easy breakage, those kind of hair, it's better to use a sulfate-free shampoo.
Right.
Even hair that is prone to becoming limp, it's better to use a sulfate-free shampoo, because sulfate-free shampoo tends to add a little more volume to the hair. So
what about dry shampoos? Now, this is something which has really come into its own recent times, right? And how are they different, and are they useful? Are they good?
Right. So dry shampoos are basically a quick fix remedy. They give you the illusion that you have shampoo. So basically, it's just a polymer that is sprayed onto the hair. It's like a powder, and that powder absorbs oil and grime, and then you just dust it out. So you don't need water. So it looks like hair that has been shampooed and conditioned without actually doing that. However, it's a quick fix thing. It's not something that we routinely recommend. It's, if typically for people who are in the media and all, if they're outdoors on a location where they can't wash their hair, then I think it's a good fix. Or someone who's traveling and they don't want to wash their hair frequently to lose that. So that sometimes, because after washing you lose your style and then you want to style it again. So to preserve the style, it's a short gap measure. Wouldn't recommend it on a routine day-to-day basis.
Right. In terms of color, like so in general, is my understanding correct when you say that products, if you were to apply, whether it's hair color and all of these things, it's not something which is recommendable from an overall health standpoint when it comes to an individual's hair?
So there are good products that are available for your hair care, something that will improve your hair quality.
Right.
So typically after shampooing and conditioning on towel dried hair, we do recommend serums or conditioning creams, which actually enhance the hair quality. And like I said earlier, curlier hair requires more gentle care. So typically hair that is curly requires additional moisturizing. So a good serum containing some light oils like argan oil or jojoba oil or coconut oil. So there are different serums that contain these, and these sort of hydrate the hair. It makes the hair more softer and pliable and less likely to break. And then you have products that are meant for styling, to hold on to a style. Then you have all your gels, pomades, pastes, mousse. So these are different products that are available, and clays. So they are used mainly to style your hair, to keep your hair in place, and if you're looking for a certain look. But these are not something that should be left onto the hair because they add residue.
Right.
Okay. So typically after your the need for styling is done, you can shampoo it out, and then whereas the products that are meant for hair care can be applied on towel dried hair and just left on.
Right.
You don't really need to shampoo them out.
Understand. So in terms of hair color, I think, especially when it comes to women, I think maybe like 80 to 90% of the women that you meet these days, I'm sure they have either highlighted their hair or something.
Absolutely.
Is that good in the long run?
So hair color typically doesn't affect hair growth. But although it affects the texture of the hair, especially if you're trying to go much lighter than your original hair color. Like if someone with dark hair is planning to go like really like blonde, then it requires a lot of multiple steps to actually bleach out all that hair, and that of course bleach can be quite harsh on the hair and it can actually affect the texture. And occasionally if the bleach comes in contact with the scalp, it can cause bleach burns and sudden and hair fall in those areas. So that you have to be, those cause the most damage to the hair. Otherwise, routine hair colors, because it is a repeated thing, younger hair is more resilient to the effects of hair color as compared to someone who's older. The hair becomes a little more, it becomes finer and it's more likely to get damaged.
Right.
So it's very important, and hair is a dead tissue. It cannot, it's not like when you get a scratch on the skin will repair itself in 8 days.
Right.
Hair is dead tissue. So once the damage has been done, you can't really repair it completely. You can conceal the damage. And that's why after coloring the hair, it is important to, use the right color protect shampoos, conditioners. It's a good idea to use a good serum, leave-in conditioner if you have very fine hair. So these are products that you must use when you do hair color, when your hair is colored. That kind of care is very important. So when someone tries to consider doing hair color, that's what we explain to them, that although it will not affect your growth, but it will affect the texture, and you have to use the right products post treatment. You have to treat the hair even more gently in order to maintain the hair color and to maintain the hair quality.
Right.
Very rarely some people get allergic reactions to hair color. Okay, and typically this happens after many years of use. A person who's been using it over the years suddenly develops an allergic reaction to the hair color. And this is very common in hair colors that contain this dye called as PPD.
Okay.
So PPD, most of the hair colors brands have this PPD, from the low end ones to the really high end ones. And if you develop an allergy to it, then you have to stop hair coloring for life. You cannot do it. In fact, PPD is also the ingredient that is found in temporary tattoos. So a lot of people develop this blistering reaction to temporary tattoos, and which also means if you develop an allergy to the a temporary tattoo, you will not be able to use hair color for life, as you when you get older. So this is something that you need to take care of to ensure that you if you develop an allergy, you stop using it, because with every repeated exposure, the reaction gets worse and worse.
Okay.
Your scalp can swell, the swelling can come around your eyes. It can small amounts can get absorbed into the body, and you can get a rash all over the body. So this is this can happen when you develop an allergy. There's another alternative coloring ingredient which is similar to PPD. It's called PTDS.
Okay.
And that the allergenic potential of that dye is a little lesser, but the color is less intense. But that is a good option for people who are generally prone to developing allergies. A person who develops an allergy to the hair color typically has a history of developing allergy to multiple things in life,
Right.
Foods, medication. So if you are the kind who develops allergies easily to skin, to foods, or to medications, to products, so it's a good idea to use something like PTDS, which will reduce the chances of developing an allergic reaction.
Right.
Or anyone who's developed an allergy to PPD, PTDS typically can be used. About 75% of people who are allergic to PPD also become allergic to PTDS.
Okay.
But there are some 25% of people who will get away and be able to use. And I think the safest color in someone who's allergic to all is simple mehendi or henna, which you buy in raw henna and you prepare it at home.
So that's very interesting. In fact, that's a question that we had as well. Is mehendi good?
Mehendi is good in its natural form. It doesn't do any damage to the hair. At the most, it will cause some hair drying.
But
it's very
usually
safe.
people use it for hair coloring.
Yes, it's very safe as long as there are no additives to it. Like a lot of black mehendi contains mehendi, and in addition, it contains PPD. So we want PPD-free henna or mehendi, and then you can add things like indigo to it. Indigo is again a plant-based color which helps you develop a more dark, a black color. So you can combine these two, and of course, it means that you have to color more frequently, because these colors don't penetrate the hair shaft. Like a hair color typically opens up the cuticle, and it contains strong agents like hydrogen peroxide, ammonia, to open up the hair cuticle and push the PPD into the core of the hair. And later on, when you condition it, the cuticle is restored. But henna only colors from the top. It doesn't open up the hair cuticle. So, which also means that you lose some of that color quickly.
Yes.
And you need to apply it more often when you're doing plant-based hair dyes. But a person who's developed allergy to hair colors, this is the only option actually, and a safe option.
Understand. What is the percentage of people who actually have this issue with PPD? Because I'm assuming that most people these days color their hair beyond a particular point. So the percentage must be less, right?
Yeah. It's not a very high percentage, but it is fairly common. And like I said, typically it happens in people who have used it for years.
Okay.
So to develop an allergy, you need to be exposed to the product for a period of time. And then one day your immune system just decides it doesn't like the color, and it starts reacting.
Right. Instant colors. A lot of people, especially in the older age these days, they tend to use a lot of those 15 minutes, 10 minutes instant colors. Is there a difference in terms of what is that in terms of color as compared to what you'd get from a more expensive or a much better product?
No, so an expensive product just does the job a lot better, because we give it enough time for the color to penetrate the hair shaft. Now, when it comes to these shampoo colors, typically they are useful for people who have white hair. because then the color can sort of latch onto the hair a little more faster. And so typically it is left on for like 5 to 10 minutes and rinsed out. However, the color lasts only for a few washes. Like it may last for about 2 weeks or 3 weeks. So typically they have to be repeated every 2 to 3 weeks, depending on how intense they want the color. But the color doesn't penetrate right down to the core of the hair in the quantities as with the standard hair color. But it's a quick fix. If you're trying to change your hair color, then these shampoo colors will not work. They'll typically work on white or gray hair where you want to get a darker shade. But you cannot lighten hair color with these shampoo colors. So typically they're done to fix, to cover up grays. You can't really change your hair color with that. If you need a lighter color to your hair, then you have to go for the conventional hair colors brands.
Right. Shampoo, again, you mentioned about this thing. So there's a question that's coming to my mind. What's the prerequisite for as a routine in terms of like shampooing and conditioning? So is it like that like you mentioned earlier, that if for someone who basically like men, they tend to sometimes like shampoo every day. I shampoo every day.
Yes.
So does that mean that every time you shampoo, you should always condition your hair as well?
Ideally, that would be good if you can do that, but you can do it. Depends on your quality of hair. If you have a good head of hair, thick hair, you could get away with not conditioning every day. Maybe every other wash you could do it.
Right.
But I wouldn't stretch it beyond that. But if you have fine hair that is processed, treated, you should condition after every shampoo, because you need to set the structure of the hair right. Because when you shampoo, again the cuticle opens up because it's alkaline. But you once you apply the conditioner, it neutralizes the effects of the shampoo and it sets the hair cuticle. So that's why it's important. It depends on the hair types. If somebody has normal untreated hair, thick hair, you can get away without conditioning. But if you have curls, if you have overly processed hair, you should condition after every shampoo. And basically all like we were discussing earlier about more affordable brands versus expensive brands. Typically more expensive brands have more plant oils in them to hydrate the hair and improve the hair texture, to moisturize the hair. And they have more ingredients in them, and of course they use more fancy fragrances. So that's how that drives up the cost. But yeah, there is a difference in more affordable brands versus more luxury brands. And typically, if you have overly processed hair, you might want to invest in a good shampoo, conditioner, or more premium one, in order to maintain your hair for the longest period of time.
Right. So ingredients is something that you mentioned that's very interesting. Are there specific ingredients that a consumer should look for in a shampoo and a conditioner?
So one should look for the label sulfate-free. If you're dealing with very limp hair or overly processed hair, that's what you should look on the label. Otherwise, from a general use point of view, it really doesn't matter whether you're using a sulfated shampoo or a sulfate-free shampoo. But sulfate-free shampoos cleanse more effectively. So sometimes you may want to use it once in a week or once in 10 days. If you're really prone to building residue, especially if you're using styling products, a sulfated shampoo will actually clear the residues better. But if you're dealing with limp hair, over-styled hair, or damaged hair that's over-processed, then you would preferably want a sulfate-free shampoo. Whereas typically sulfated shampoos contain this ingredient called sodium lauryl sulfate or sodium lauryl ether sulfate, SLS or SLES. So those are typically the first or second. After water, you'll see it will be the second or third ingredient. Whereas sulfate-free shampoos contain these detergents called as CAPB, then sodium lauryl sarcosinate, decyl glucoside. These are different non-sulfated detergents that are used in combination because in order to produce a good lather. So sulfated shampoos lather very well. Non-sulfated shampoo, sulfate-free shampoos don't lather effectively. So you have to use multiple non-sulfated ingredients. So you feel that it's cleaned your scalp. Sometimes shampoos meant for very overprocessed hair or very stressed out hair. They tend to use very mild detergent so that the hair doesn't get too damaged or weathered. But they don't really, you don't get a sense that it's been cleaned well. Typically, as Indians, we are conditioned to a shampoo has to lather well to cleanse. So sulfate-free shampoos contain a mix of detergents, which maintains a good foaming capacity.
But what is the percentage of products that we get in India in terms of shampoo? Like if you were to draw a base, that they are sulfate-free. Are the regular products, the popular ones, are they sulfate-free?
So now most brands, the OTC brands typically have, they are sulfated. It's the salon brands which have both sulfated and non-sulfated. So sulfate-free ones are typically salon brands because after the cysteine treatments or keratin treatments, or even after intense hair coloring or back-to-back hair coloring, you want something more gentler. Whereas all the OTC brands, even your Ayurvedic and all of these brands, they typically contain SLS or SLES.
Wow.
So these herbal shampoos and all, you can generally, most of them you can take that tag with a pinch of salt. They are not safer or less damaging to the hair, because ultimately they also contain, the lathering agent is SLS or SLES. And someone who has very dry scalps or very damaged hair, even these shampoos are not the best for them.
Right. Yeah. I don't know if this is a myth or not, but you get to hear this a lot. A lot of times when you use these anti-dandruff shampoos, like say for example, if it's a Head and Shoulders or something of that sort, and then multiple people say that once you stop using them, you tend to get more dandruff.
Right.
Is that a myth, or that's just a condition that usually users have?
I don't think there's a rebound happening there. It will eventually, dandruff will come back. So dandruff, or this condition called as seborrheic dermatitis, it is basically 2 or 3 things are going wrong there. One thing is there's a overgrowth of bacteria and yeast on your scalp.
Right.
And second is your immune system is at war with that bacteria and yeast. Okay, so it's constantly sending out inflammatory signals and triggering abnormal blood vessel growth. The scalp cells start to divide very fast, and they grow at almost 5 to 10 times the normal rate. So it piles up as flakes. So when we treat dandruff with an anti-dandruff shampoo, it basically contains an antifungal ingredient which lowers the counts of the yeast and bacteria, and that's how it reduces, it indirectly calms the immune system. Plus some of these anti-dandruff shampoos, they contain ketoconazole, cycloperoxylamine, zinc pyrithione. These also have anti-inflammatory benefits, so they also calm down the inflammation and the immune system. And it's, again, like I said, it's important to shampoo more frequently, especially if you're dealing with dandruff or seborrheic dermatitis, because you want to, because the cells are growing so fast, they pile up, and you want those built up residues to wash off. Like you want to avoid build-up.
Right.
But dandruff is something that is intrinsic to your nature. It's not something that you cannot eradicate it completely, because it's in your genes. You cannot change that. So there will be certain times of the year when dandruff will worsen, and there will be times of the year when dandruff will reduce. And typically we see this after during a viral fever. Anything that activates your immune system will worsen your dandruff. So even around viral fevers and all, or post a viral fever, you'll see that your dandruff will worsen. Extremes of weather, hot and humid weather, or cold and dry weather, or very hot and dry weather, all of these extremes will actually trigger your dandruff. In a person who's prone to dandruff, if they have very poor nutrition, if their diet is very high on sugar containing foods or very ultra processed foods, these can trigger some hormonal imbalances, which makes the scalp more oily and worsen dandruff.
Right.
So there are multiple factors. So after discontinuing an anti-dandruff shampoo, you will not see a rebound, but your dandruff will slowly come back. So you need to use anti-dandruff shampoos. In someone who is having dandruff, they must use it at least once a week in order to keep the dandruff in check.
So that means somebody who has a dandruff problem and will use an anti-dandruff, then they should not use the anti-dandruff shampoo every day?
No, they can use, depending. See, initially, when you're treating it in a more acute phase, you may need to use the anti-dandruff shampoo frequently through the week, maybe daily or even alternate days.
Okay.
But as the condition comes under control, you can use it once a week, and the other times in the week you will use a regular shampoo. But shampooing is important. You do it daily or alternate days, or at least wash your scalp every day. So typically it's more worse in men. So it's a good idea to shampoo every day to maintain, and you can use anti-dandruff shampoo either daily, alternate days, or few 1 or 2 days in a week, based on how severe the condition is.
Right.
Yeah.
So a lot of men tend to do a lot of riding.
Right.
Right. And when you're doing riding, that means you need to wear helmets, you need to wear caps,
Absolutely.
you need to wear all of these things for the skin as well. Does that aggravate a situation, or does that create dandruff? And how do you deal with that?
I think it will aggravate dandruff if you're sweating. If you sweat and that sweat is trapped on your hair, because sweat contains a lot of inflammatory molecules. If your scalp is already prone to inflammation, that sweat will worsen the inflammation and worsen dandruff. And if you have issues with hair fall, it may worsen hair fall also. So it's a good idea to shampoo that sweat out at the end of the day. Don't leave it overnight. It will cause more inflammation.
But so that means, like, if they, for example, are going riding to work and then coming back, then the night is always recommendable for you to wash your hair again? Or
no, end of the day. One time in the day, end of the day or in the morning, whatever.
Right.
But if you're prone to sweating a lot, then at least at the end of the day, you must wash it out rather than allowing it to dry overnight and inflaming your scalp. So in the evening, you can just rinse it with plain water, and you can shampoo in the morning the next day if you are sweating it out a lot. Or if you're the kind, you can shampoo in the evening and maybe not shampoo in the morning. It depends on your lifestyle. Yeah.
Right.
Typically, after gymming and all, it's a good idea to just shampoo out that sweat.
Very interesting question that's coming to my mind is, when you go to a salon or for a haircut and stuff like that, then they really shampoo just like very lightly and just for like a few 5 or 7, 8 seconds. Whereas when you're doing it at home, you actually tend to, as you said, you try to get a lot of fizz, or I don't know the term. Is there a right or wrong way in this, or is
right? So the thing is, you have to minimize the contact time of the shampoo.
Okay.
It's better to just shampoo and if someone who's shampooing every day doesn't have too many residues on the scalp, or it's not oily, you can just shampoo, work up a lather and rinse it out. When you're using anti-dandruff shampoos, you can leave it up to 3 minutes, depending on how itchy your scalp is. If your scalp is very itchy and inflamed, 1 minute. If it's not, you can leave it up to 2 minutes, maximum 3 minutes, and rinse it out. And then follow it with a conditioner. So it depends on. Generally the rule is work up a lather and rinse it out.
But it should reach your scalp.
It should reach your scalp. Yeah. You're trying to cleanse the scalp and the hair. A lot of people have oily scalps and dry hair. So there you'll focus the shampoo mainly on the scalp. And some people have both oily scalp and oily hair. Then you will want to sort of cover the entire length of the hair with the shampoo. So it really depends on how oily the scalp is, how oily or dry the hair is. And based on that, you can decide how long to leave it on. Typically, before they do a cystine or keratin treatment, they actually leave the shampoo on the scalp for 5 minutes so that the detergent in the shampoo can literally strip off the greasy layer of the hair so that the products can penetrate and bind. So only in those situations they leave it on and they do multiple rounds, like two to even 3 rounds of shampooing, and each time they leave it on for 5 minutes.
Right.
But otherwise, in a day-to-day, if you're shampooing frequently, just shampoo, work up a lather, rinse it out.
In terms of, is oily scalp sort of a situation reversible? If somebody has oily scalp?
Yeah. Typically, younger people tend to have more oily scalps. If you're acne prone, you're more likely to be oily on the face as well as the scalp. But for a lot of individuals, if there's a genetic predisposition, you're prone to developing oily scalps, and then your lifestyle will play a role. Typically, oil glands are activated by insulin and something called as insulin-like growth factor. A lot of that is tied down to your diet. So if your diet is high on sugars, in forms of or ultra-processed foods like biscuits, soft drinks, fruit juices, ice creams, chips, fries, all of that. it will spike up your insulin, and eventually the insulin goes and acts on the oil glands, and it stimulates the oil glands. So the oil gland has an entire set of enzymes which can produce its own hormones.
Wow.
So the insulin actually drives the oil gland to produce more male hormone, and that makes this activates the oil glands and causes more oiliness. And if you're dealing with dandruff or something, it'll actually worsen the condition. So a lot of the oily scalp is actually tied down to your diet and lifestyle, because that's the only way you can minimize. And sometimes you need medications to reduce oiliness. A lot of women with hormonal imbalance or PCOS, polycystic ovarian syndrome, they tend to develop oily scalps because their oil glands just produce a lot of male hormone.
Right.
Or their ovaries are producing male hormone and the oil glands pick up and they synthesize something called as dihydrotestosterone out of it, and that makes the scalp more oily. So this is very common in girls with hormonal imbalance.
So marketing fads, like, I don't even know if they're marketing fads or not. Maybe you can throw some light on this. Shampoos like beer shampoos, egg shampoos, XYZ, do they really work?
I mean, like you said, they are marketing fads. The detergent in all of them is the same. Probably the fragrance is different, but they don't add any additional benefit to it. But there are certain ingredients in shampoos like hydrolyzed protein, wheat protein, that can be added, or amino acids are added to sort of hair, to repair the hair structure. So those are added in some premium high-end shampoos. They sort of help to a certain extent repair hair damage. But beer, egg, all of this, it's just marketing, right? There's barely any of that in the shampoo.
Got it. But if you were to use like beer directly, like a lot of people I know, they do sometimes just put beer, and apparently it really, I've never used it, but does beer in general help in smoothing your hair?
Yeah. So beer is slightly acidic in nature.
Okay.
And the natural pH of the skin and hair is slightly acidic. So it sort of reinforces that. Plus beer is typically cold. So cold temperature always closes the cuticle, whereas hot and warm temperature opens up the cuticle. So probably it may work by smoothing out, improving maintaining the pH of the hair, and by virtue of that it could close the hair cuticle because it's cold. But other than that, I don't see any benefits to it. And plus, who wants to go around with a head smelling like beer? You know? I mean, it's a myth. I think it's better to have the beer than you waste it on washing hair.
Right. In terms of egg as well, now I know, like in India, Holi is like a big thing, right? A lot of people, they also use this as an excuse to just break the egg on your hair. Right. And then after that, when they wash it miraculously, it's actually very soft and very silky and things like that. So does egg have any bearing to your hair? Does it make it better or worse?
So egg typically is protein rich. So that's why when you apply it to the hair, there's no really studies to show that it really improves hair quality. I mean, you could do the same with a shampoo and conditioner. But egg is a protein rich source that one should consume if possible in order to just improve the hair nutrition. Because, hair is protein, right? So you need a good amount of protein in your diet to have good quality hair. Otherwise, it will suffer. Okay.
Let's talk about graying, because I think that's something which is so rampant these days with a lot of younger people as well.
Yes.
So to start off, my first question is, I've seen infants who've now started developing graying or white hair.
Right.
Is that a condition or a one-off, or is something which happens, it's been happening for a long, long time?
I think it's been happening for a long time, but premature graying is defined as graying of the hair in Indians. It is before the age of 30.
Okay.
Typically in Indians, our hair starts to gray around the early 30s, mid 30s, and then it picks up. But premature graying is anything less than the age of 30. Now, there are multiple factors that are tied to hair graying. Most important is genetics. If you're prone to, if you have a family history of early graying, then you're more likely to gray earlier. Some studies have shown it's tied down to a nutrient deficiency.
Okay.
So a low vitamin B12, low vitamin D, which is common in most Indians, low iron stores. There's a molecule called ferritin, which is an iron store, which indicates iron stores in the body. If that is low, you can develop earlier graying. Certain deficiencies of vitamins in the B complex group, those can trigger early graying. Stress is a known factor. In severe stress, people have developed graying within a week, and typically when that stress goes away, they develop, the color resumes over a period of time. So there are multiple factors. Even UV light is known to trigger early graying. So if you're out in the sun a lot and your scalp gets damaged or the hair undergo repeated chronic sun damage, it can trigger early graying. Graying can also be triggered by antioxidant deficiency. So because hair is a very fast growing tissue, it generates a lot of free radicals, compounds that are developed during normal growth processes. But there are systems in place to sort of quench those free radicals. So anyone who's born or has a poorer antioxidant mechanisms, they tend to develop graying faster. Or if your diet is very poor because as we get older, our natural antioxidant mechanisms slow down.
Right.
So we need to get those antioxidants from our diet. And typically, if you have a poor diet, then it may contribute to you'll get less antioxidants and you won't get free radical quenching compounds, and that will trigger graying. Then, so these are broadly the conditions which can cause graying. And another thing is it can happen in autoimmune conditions, graying. So if you're prone to autoimmune conditions like autoimmune thyroid disease or autoimmune skin disease, then there is a higher chance that you might develop early graying. Sometimes early graying can occur in conditions which lead to accelerated aging.
Right.
Sometimes a person who has Down syndrome or various syndromes, genetic abnormalities, which can trigger early graying. If you're prone to aging faster, you will gray earlier.
Right.
So those are rarer cases.
Right. But in case what I'm asking is say, for example, parents to young infants 2, 3, 4, they start seeing 1 or 2, gray, a little bit of white hair or graying. Is that a cause of concern or is just a one-off usually?
So typically we do get patients anxious parents when they get even a gray hair or 2, they panic and they come to us seeking guidance. But see, 1 or 2 hairs, if you have 4 or 5 hair strands which are gray, it's not a problem, because typically what happens is towards the end of its life cycle, the hair may lose its pigment and become gray and shed, and then it will be replaced by a dark hair. So if there are just few hairs, one of the treatments is actually to pluck out gray hairs, and it actually initiates a new growth cycle, and that hair is usually pigmented or dark.
Oh,
so it's a myth that plucking out grays will cause more grays to form. That's a myth. They can be safely plucked out, and when it triggers a new hair growth cycle, and the hair is pigmented.
So that's a question also that I had, is that usually they say that when you are graying and you start using hair color, then it also the graying will happen a lot faster.
Correct.
Is that true? Does it happen?
So I don't think the verdict is out on that one. There are several mechanisms which may cause the hair to gray excessively. One is that the hair color process involves a very strong bleach. So you have to bleach the native pigment and then introduce your synthetic pigment.
Got it.
So when you repeatedly color, you're bleaching out the hair's natural color, and then you're replacing it with the pigment. Of course, the pigment gets washed out after a few shampoos, your hair color. So that's why it can make the hair grayer. Second thing is because strong oxidant compounds like hydrogen peroxide and all are used in hair. They say that people who have weaker antioxidant mechanisms, that hydrogen peroxide can actually damage the hair root and trigger, the color-producing cells in the hair follicle and trigger graying. But the verdict is not out on that one. But I think I've not seen it really hair color influence, because when young people color, their hair don't turn gray. I think if a person was going to develop a gray, progressive graying as they get older, I think that process will continue. I don't think hair color really adds too much to that process.
Is graying reversible? Does it really happen?
So graying is reversible, especially in some cases where it's come out of nutritional deficiencies, or if it's come out of acute stress, then it can reverse. Or if there was malnutrition, and when you restore good eating habits, and it may reverse. Typically, what happens is when the gray hair sheds, the hair that grows is a darker one. Or if it was very acute stress-related graying, the hair may temporarily gray and then it'll turn pigmented again. So you'll see bands of light and dark bands across the hair shaft. But after a certain age, I would say typically after the mid-30s, it's difficult to reverse graying. You can only slow down the process of graying.
Okay.
But in children and young individuals, you can expect reversal of graying to a certain extent. There are some products available in the market now. There are peptides which stimulate melanin production. A lot of Ayurvedic compounds, like they have these oils which have certain plant extracts which may stimulate the color producing cells. So there have been anecdotal reports of people using some oil and restoring their hair color, but these are anecdotal. There have been no large studies, and I don't think it's reproducible. It has been reproduced in studies. So hard to say, but yeah, after a certain age, don't expect the grays to reverse. Typically beyond the mid-30s, you can only slow down the progression.
Right. But the use of products, do they trigger these graying as well? Like, for example, let's say men. Now, men use a lot of gel,
Yes.
a lot of times and things like that. And then, does that also trigger a lot of graying in terms of exposing your hair to those products?
No, not really. Products are generally safe. They don't affect hair growth in any negative or positive way. So they can be safely used. The issue is when you do any tight hairstyles like a man bun or something. If you hold it in place for tightly, it may cause something called as traction alopecia. You can lose roots permanently over a period of time because of that constant tension and pull on the hair. But so any hairstyles which exert tension on the hair root, those can trigger traction alopecia, which is scarring. It's permanent. But other than that, for loosely styling the hair, there is no issue. Products don't cause any hair loss.
Okay, but it's recommendable, and you should always wash it at the end of the day if you've applied.
Yeah, to avoid buildup. Because especially if you have sensitive scalps or oily scalps, all of that, the product plus your own, day-to-day oily secretions, they mix and they create a mess. So it's always better to clean this scalp, shampoo at the end of the day, I think, or at least the next day you must shampoo it out.
Right.
Not leave it on for days together.
Right. You spoke about alopecia. It's very interesting. So let me understand this correctly. Alopecia is basically where you develop a skin condition and it starts creating a patch.
Correct.
Right? Like it can appear at different places, but is it true that usually it is most likely at places where you have hair?
No, so alopecia is loss of hair.
Okay.
And then broadly it's classified into scarring and non-scarring alopecia. So scarring alopecia is where you would lose your hair roots permanently. You cannot grow them. Okay. And those happen in some autoimmune conditions called as lichen planus, DLE or lupus. And there are something called as, dissecting folliculitis decalvans, where they come with pus-filled lesions, or sometimes children, if they develop fungal infections of the head, they can be quite, they can create abscesses and boils, and some of the root can be lost permanently. So these are scarring alopecias. The roots are gone permanently. You cannot grow them back. And there is the other group that is non-scarring alopecias, where the most common is the typical patterned hair loss that happens in both men and women as they age, genetics and age. Common balding or hair thinning in women.
Right.
So that is the most common that we see. And then this is genetics and probably lifestyle related that causes this patterned hair loss. Then you have autoimmune alopecias, which can be non-scarring. Like very commonly is alopecia areata, where you develop a coin-shaped patch of hair loss.
Yeah.
So, yeah.
That's what I was referring to.
Correct. So that is called alopecia areata, whereas it's called as patchy hair loss.
Okay.
And common balding is androgenetic alopecia, or male pattern hair loss, or female pattern hair loss. So alopecia areata is autoimmune. So it is a reversible cause of hair loss. So with treatment, you can grow the hair back. And there's a whole spectrum to it. At the mildest end of the spectrum, you have people who develop 1 or 2 patches later on in their adult life, and the hair grows back sometimes without treatment, and it may reoccur once in a few years or once in a few months. As opposed to the other end of the spectrum, where people develop large patches all over the scalp, or rapidly, rapid hair loss. Sometimes they can go bald within a matter of days. So this is called as alopecia subtotalis universalis, where you lose sometimes even body hair. You typically have that look where you lose all your hair, and both on the scalp, face in men, and the body. So that is the more rarer end of the spectrum.
Okay.
It's uncommon. But the commonest is just a few patches which come and go. And with treatment, the hair can be sort of restored rapidly.
Right. You mentioned earlier about how the hormonal changes can have effect on some of these conditions, and also in terms of the hair growth as well. So that's a lot to do with testosterone, right? Because as the testosterone also develops, or your hormones develop at a later stage, then you start getting hair growth a lot. Does that happen commonly? Because there are so many examples that I've seen of people who've, like, what do you call, say for example, men as well, who've throughout their life, they've had hardly any body hair. Like for me as well, if I say personally, I hardly have any body hair. But in the last 4 or 5 years, I've actually started developing a lot more hair growth as compared to what it was earlier.
Correct.
So
this is typically how this hormone dihydrotestosterone works.
Okay.
So dihydrotestosterone is a byproduct of testosterone. So when testosterone from your blood comes into your skin around the hair follicles, there are certain enzymes which convert it to this form, DHT. Now, dihydrotestosterone is very important at certain stages in a man's life. One is when they are growing in the womb. In order to produce a male fetus from a unisex fetus, you require dihydrotestosterone for development of the external genitalia in a male. To make a male fetus, you need DHT.
Got it.
And the second time when it's important is at the onset of puberty. So DHT is important for the secondary sexual hair, as we call it. That secondary sexual characteristics. Okay, body hair growth, typically on the arms, legs, underarms, pubic area, facial hair. So this is important. DHT becomes important at that time to develop, male characteristics. However, in people who are prone to balding, that DHT can have the negative effect on the hair. It may actually cause hair thinning and hair loss, because that's how the mechanisms are. Although the same hormone is responsible for body hair growth, at the same time, overexpression of it can affect the scalp hair negatively. It can make it thinner. And this is what happens in balding men. The dihydrotestosterone progressively miniaturizes the hair follicles, and some of them are lost forever. So DHT is also responsible for creating this V shape that most men have along the temples.
Okay. Yeah.
So that is a normal amount of recession that happens in all men. But however, anyone who's prone to balding, more severe grades of balding, it is this DHT that is responsible. In women also, this DHT is responsible, because both men and women have testosterone. Levels are different. And it depends on what enzyme sets you have inherited. So a large portion of testosterone can get converted to dihydrotestosterone in women also, and that can trigger hair thinning. And there are certain hormones that come from adrenal glands also, which can convert to this DHT. And a lot of women who have some PCOS, if there is a condition called as non-classical congenital adrenal hyperplasia, in which your adrenals secrete certain testosterone precursors, which convert to dihydrotestosterone and cause hair thinning, or It can be hair thinning on the scalp, and at the same time they can develop facial hair and body hair, in abnormal in some areas, that is called hirsutism. So it's actually the same hormone which acts differently on different areas of the body, which results in this manifestation. Okay, so it's different for different individuals based on their genes and the enzymes that they have.
What triggers it? Are there like general triggers which trigger this hormone, or it can happen at any point of time to anyone?
So it all depends on your genetic susceptibility to the hormone. If you don't have a balding, even high levels of DHT will not affect your hair follicles. Okay. But if you are born with a tendency to be excessively sensitive to even normal levels of DHT or high levels of DHT, then it can trigger hair loss. So that there's a lot of variations to that. It's not a black and white rule. And everybody, even balding, there is a spectrum. At one end, you have very mild hairline recession, which is seen in all men, versus at the other end, where men lose their hair at very, at a young age, they start to bald very rapidly. Having said that, genetic susceptibility is the most important, but your lifestyle also determines how fast your balding will progress. And typically, we've seen people who are more obese, they are likely to lose hair much more faster, because stress also causes more testosterone to convert to DHT.
Okay.
So that can happen. There are other factors to hair thinning. Most important factor is androgens, that is testosterone and DHT. There's another group of signaling molecules in the skin called as prostaglandins. So there is a good prostaglandin and a bad prostaglandin, and an imbalance between the two can trigger hair fall. Then it also depends on bacterial and fungal colonization of the scalp. So typically, those who have higher numbers of bacteria and yeast and an inflamed scalp, they tend to develop. It tends to progress a little faster. Then nutritional, deficiencies of various, protein, B12, D3, iron, zinc, selenium. All of these copper. All of these can affect deficiencies of these can affect hair growth negatively.
Right.
Also, people who are more prone to balding, they have more oily scalp. So there is an abnormal amount of sebum or oil production. Typically a hair that grows well, the glucose, that is absorbed from the body converts to a form called glycogen, which is also stored in the muscle. So it's also stored in the hair follicle, because hair is a very fast growing tissue.
Right.
And so it needs its store of energy. Okay. So the glycogen is important for hair growth. However, in people who are prone to hair thinning or hair loss or hair fall, all this glucose is channelized to producing oiliness, the sebum, instead of producing glycogen. So there is something intrinsically wrong,
right,
in which this happens. Then scalps that are prone to microinflammation. Okay, constantly the scalp is inflamed, red. These actually cause more hair fall. Another thing that goes wrong in hair thinning is reduced blood supply to the hair follicles. So under the influence of hormones, these hair follicles start to sort of miniaturize, and their blood supply is also cut off and diminished.
Okay.
And that can lead to hair loss. Then also the formation of scar collagen. Okay, so this is another factor that affects, because long term, when you lose hair for a long period of time, like you're bald for a longer period of time, the collagen structure around the hair follicle changes. You have more of a scarring type of collagen versus the normal healthy collagen, which can also influence hair growth. And then there are various other conditions which influence hair loss, like if you're diabetic, if you're hypertensive, generally if you have atherosclerosis, like a coronary artery disease, and all these people tend to have a faster progression of alopecia, high BMI, obesity, being overweight. All these are other lifestyle factors that if you're prone to becoming bald, it will just accelerate at a much faster pace.
But is the thought process that your hair is growing much faster a condition where it's a sign of being healthy? Because like they say, like doctors also always say that if your nails are growing a lot faster, your hair is growing a lot faster, that means it's a sign of you being healthy. Is that true?
Absolutely, I would say so. I mean, hair, can grow only at the rate of 1.2 centimeters a month, 1.2 to 2.5. So it's not possible to grow faster than that.
Okay.
But of course, if you have, hair is growing at that optimal rate, you would see a head of healthy hair. And typically, people who have good hair growth typically also have good nail growth, because the nutrients that are required to produce hair and nail are similar. So yeah, good nutrition, especially like if you have a person who's well nourished and they're getting the adequate amounts of nutrients, proteins, and all of that, you will, they have a better head of hair. But it cannot grow faster than 1.2 centimeter a month. That's where it maxes out.
Okay. Is facial hair like beard different from the hair on your head?
Yes. So facial hair is much more thicker.
Okay.
And it lives a lot more longer. Beard hair can grow up to 10 years. Yeah. Typically, scalp hair grows between 3 to 7 years in people who have long hair, or maybe slightly longer. But beard hair grows for really long. And that's why beard hair starts to gray much earlier than the scalp hair. Initially, most men tend to develop a beard graying before they start developing, because that hair grows so long, it doesn't shed out. So once it turns gray, it will grow as a gray hair unless it's plucked out, and then and beyond a point it becomes difficult to. It will become permanently gray. But yeah, beard hair, even the thickness, it's a much more thicker. It tends to be much more curlier, so they have a more oval cross section instead of a cylindrical cross section. So there is a difference in the nature. And in fact, for a lot of people, when they do hair transplant, if you don't have enough scalp hair, they do take grafts from the beard and sort of transplant it into the scalp, which is because that beard hair is quite thick, and it has its androgen. Only at puberty it starts to thicken under the influence of DHT, but it doesn't thin with life.
Okay.
Men may continue to bald by the age of 50% of men develop signs of hair thinning or balding. But that doesn't happen on the beard.
Understand.
Yeah.
So you spoke about the patch alopecia. There's a new trend which I read about and even we were discussing. Hair tattooing.
Really?
Yeah,
I've not heard of that.
So I was surprised when I heard this. So I was told that when you get like these smaller patches and things like that, then people actually go in for like hair tattooing so that they're able to hide that.
Okay. Yeah, that's called scalp micropigmentation.
Okay.
So you can actually tattoo your scalp with a dark brown colored ink to give the illusion that it's covered with hair. So this is actually a good treatment option for people who have had scarring alopecia, where even hair transplant becomes difficult because it's all scar tissue. You can't plant hair into scar tissue and they may not grow well. So it's a way of camouflaging the scalp. So you can tattoo ink into the areas that have hair loss and improve the density, or even anyone who has lower density of hair, if the scalp is very visible, then you can tattoo this ink into the scalp to give an illusion of better density of it. Yeah. So
it happens, is it?
Yes. It's a tedious process. It takes a really long time, and you need multiple sessions. Because the problem is, if you use permanent colors, sometimes they turn green. And mostly people prefer now semi-permanent colors and dark brown, so it doesn't turn green over time. But the downside is you have to do maintenance, and for a person who has a large surface area to cover, it can become quite cumbersome. It's quite a tedious process.
I think especially for the skin that we have or the color, because usually like tattooing, right? I have a few tattoos as well. So Indian skin is not really very well versed to accepting a lot of colors. So which is the reason why it does tend to turn a lot greener than ideally doing what we do. Now coming back to the beard bit, like you said that usually it tends to grow quite a bit. Then a lot of these beard oils and all of these things, are they recommendable? Do you need to moisturize your beard regularly? Does it?
Actually, a simple conditioner also will do the job. You don't need a beard oil, but maybe if somebody is trying to style their beard a certain way or maintain then I guess a beard oil just makes your beard more shiny. It doesn't really affect the growth overall.
Okay.
But they're harmless. I mean, they really, as long as you're using it only on the beard and you're not getting it on your skin, sometimes you can get breakouts.
Oh. So that means you should actually shampoo your beard as well?
Yes, you should. You should cleanse your beard, and if you have really long beard hair, then you should probably use a conditioner also.
Oh, the
And
same
it's,
one that you use for your hair.
absolutely.
There's
That
no
would work.
different one because it's on the face. But
Yeah.
isn't it like that if you, because there are chemicals in them or there's some ingredients, if you use it, then it can actually do breakouts on your skin?
No, that if you have acne-prone skin, certain oily products may cause some breakouts. Conditioners typically have silicones in them, and I mean they are rinsed out, right? So they typically don't cause any issues. But yeah, if you have long, I mean you need to condition it only if you have long beard hair, and typically that you can avoid applying it frequently on the skin. Just apply it on the length of the hair down to the tip to maintain good hair quality, beard hair quality.
But what are the common causes of hair loss in men and women? Are they same or they're different?
I think they're slightly different. In men, the commonest is, of course, male pattern baldness. So, because a lot more men have it, so they present with hair loss. But women also develop a lot of, I mean, almost most women will constantly, they're worried about their hair because they see a lot of hair fall. And, it's their crowning glory. So, I mean, there is panic sets in when you see a lot of hair fall. The most commonest cause of hair fall is this condition called as acute telogen effluvium, which is sudden shedding that happens, massive shedding that happens after any acute stress. So, if you're recovering, if you had any illness, viral fever, which had, high fever, and, like malaria, dengue, typhoid, COVID, influenza. So typically, the hair follicles, some hair follicles go into a shock and they stop growing because of the illness. And then they start to shed after 6 to 8 weeks. So typically, in the third month following the illness, third and fourth month, you can see massive hair shedding. You can see 100, 200 hair falling every day. And it can be very distressing.
Right.
And then it also depends on the individual susceptibility to, a condition. We've seen that this happening following weight loss also, excessive weight loss. Typically, when you lose 3 or 4 kgs or higher than that, it triggers massive hair loss. And it doesn't matter how many kilos you gained and then you lose. If you gain 10 kgs and you lose 3 or 4 kgs, you will still develop hair fall.
Got it.
So, any weight loss will trigger significant weight loss, I would say about 3 to 4 kg, will trigger some hair shedding. And then you have, so these are the commonest causes that we see following an illness and weight loss. And then you have something called as chronic telogen effluvium, where the hair fall is persistent for 6 months or longer.
Okay.
So a lot of these patients who develop acute hair loss can progress to chronic. And chronic telogen effluvium by itself can occur in women due to nutritional deficiencies. That's very common. Low iron, low B12, low D3, low protein in diet. All of this can contribute to hair shedding because hair is very fast growing tissue and it likes consistency. So if there's a slight disturbance in your nutrition or lifestyle, it can affect hair growth.
Right.
And, and that susceptibility increases as you get older, So, chronic telogen effluvium, this is the commonest cause. Then you see it typically with hormonal imbalances, like in PCOS or congenital adrenal hyperplasia. Excess of androgens, that's male hormone, over female hormones is also a very common cause of hair loss in women.
You mentioned that earlier.
Yeah.
Right.
So these are the most commonest cause. Then you have drug-induced hair loss. Certain medications can trigger hair loss. So very commonly we prescribe one medicine called isotretinoin for treatment of acne. And that is known to trigger hair loss. You have hair loss that follows cancer or chemotherapy. Chemotherapy, because hair is a fast-growing tissue, chemotherapy also affects the hair adversely, and it can result in hair shedding. Even post breast cancer, women are put on anti-estrogens that can cause progressive hair thinning. So there is drug-induced hair loss is also very common. Certain blood pressure medications, anti-epileptic or anti-seizure medications can cause progressive hair thinning and hair loss. even women who are on birth control pills, after they've taken it for a while, typically we've seen that if they've been taking birth control pills for a long time and when they discontinue it, it can trigger hair fall. Typically, again, 3 to 4 months after discontinuing birth control pills, if they've been on it for a long time.
Right.
So these are very common causes of hair fall and hair loss that we see.
Great. Thank you so much, Dr. Rickson, for coming in again. And of course, doing this, there's so much that actually we had to discuss. And I'm so happy in a way because we did not discuss a lot of that in the previous podcast. Because come to think of it, there is actually so many things that are related to hair that it's just not possible to still cover. I'm sure that there's still so many things that we still have to cover. But then, this was really good and it was great fun. So I hope you had fun as well.
Thank you. Yes, I had a lot of fun.
Great. Thank you so much.
Always good. Great to be with you on the podcast.
Thank you so much. It was really good fun. And there's still a lot of things that we need to discuss. So we'll definitely have you back as well.
Absolutely.
Thanks.